In this lecture, we are discussing about the dosage formulation and what is the need behind dosage formulation. In the types of dosage form means by which the drug molecules are delivered to sites of action of the body. The need behind the dosage form, they provide accurate dose, protection, for example coated and sealed ampoules, protection from the gastric juice, mask the taste and odor, placement of the drug within body tissue, sustained release medication, controlled release medication, optimal drug action, insertion of drug into the cavity like rectal and vaginal cavity of the body, the use of desired vehicle for insoluble drug. These are the few basic to overcome the difficulty in the dosage form. The dosage form broadly classified into two types. The first one is called route of administration. Example in that the oral route of, secondly dermal, the drug applied topically, rectal injectables, vaginal, inhaled ophthalmic formulations, otic and the nasal formulation. In the physical form, there are solid, semi-solid and the aerosol. Aerosol is a more important part in the route of administration. In oral dosage form, the example in that we have tablet. Tablet is a hard compressed medication in different type of the shape like round shape, oval shape or square shape. The excipients are included with the formulation of tablet. We use binders, glidant and lubricant for to get a ensure efficient tableting. Disintegrators to ensure the tablet breakdown in the digestive tract. We add sweetener or flavor helps to mask the taste of active ingredients. Pigments they to make the uncoated tablet visually attractive. The tablets having a more important factor that is called coating of the tablet. Coating of the tablet helps to hide the taste of the tablet component. It will make smoother, by this would easier to swallow, make it more resistant to the environment and extending its shelf life. The another form of tablet is a buccal and sublingual tablet. These medications are administered by placing them in the mouth, either under the tongue or between the gums. The medication here dissolve rapidly, absorb through mucous membrane, then they will be enter into the bloodstream. In this case, avoid the acid and enzymatic environment of the stomach and drug metabolize enzyme of liver. The drugs which are administered by this method, the nitroglycerin or vasodilator and steroidal hormones are also administered by these methods. Effervescent tablets are uncoated tablets, contain acidic substance like tartaric acid and citric acid, along with the carbonate or bicarbonate which react rapidly in the presence of water by release carbon dioxide. The effervescent tablets intend to dissolve or disperse in the water before use. These effervescent tablets having a very rapid tablet dispersion and dissolution. Effervescent tablets have a pleasant tasting carbonated drink. The chewable tablets, these tablets are chewed prior to the swallow. They are designed for administration to the children. The example of chewable tablet like vitamin products. In case of oral dosage form, the another aspect we have a capsule. Capsule is a medication in gelatin container. The capsule make a mask over the unpleasant taste of its content. There are mainly two types of capsule, hard gelatin and the soft gelatin. In case of hard gelatin, they are normally used for dry powder ingredient. In case of soft gelatin, the oils and for active ingredients that are dissolved or suspended in the oil. Lozenges. These are solid preparation, consist sugar and gum, giving strength, cohesiveness to the lozenge, facilitate slow release of the medicament. These are used for to medicate the mouth and throat for slow administration in digestion or the cough remedies. Pastilles, they are similar as a lozenges, having solid medicated preparation designed to dissolve slowly in the mouth. They are softer than lozenges because their base like glycerol, gelatin, acacia and sugar. In case of dental comb, they are intended to place in empty socket following tooth extraction. These are used for preventing a local multiplication of the pathogenic bacteria associated with the tooth extraction. These dental combs may contain antibiotics or antiseptics. Pills are not rarely used. Pills, in case of oral dosage form, consist spherical mass prepared from one or more medicament incorporated with inert excipients. Granules, they consist solid dry aggregates of powder particles supplied in single dose sachets. Granules are placed on the tongue, swallowed with water, and the effervescent granules evolve carbon dioxide when added to the water. Granules are intended to be dissolved in water before taking. Powders, there are two types of mainly powder which are intended for internal use, bulk powder and dividend powder. In case of bulk powder, multi-dose preparation consists solid, loose, dry particles of medicament with very degree of fineness. They contain one or more active ingredient with or without the excipients. Sometimes if we need to mask, we use coloring matter and flavoring agent. The powder usually contain non-potent medicament, for example like antacid. The patient should measure a dose by volume using 5 ml of medicine spoon. The powders, in case of effervescent, they will be dissolved in the water before taking. Divided powders are single dose presentation of the powder. For example, small sachet intend to be issued to the patient to be taken in or with water. The powders for mixtures. The mixed powder stored in dry form. They are prepared by pharmacists when there will be a requirement of the dispensing by suspending the powder in appropriate vehicle. There are another group of dosage form that is called liquid preparations. In that case, we have oral solution, oral emulsion, and oral suspension. In case of oral solution, is a clear liquid preparation for oral use contain one or more active ingredient dissolved in a suitable vehicle. In case of oral emulsion, stabilized oil in water dispersion, either or both phase of contain dissolved solid. Oral suspension, these are liquid preparation for the oral use contain one or more active ingredient in suitable vehicle. In case of oral suspension, it may show a sedimentation which will be readily dispersed on shaking to give a uniform suspension. Syrup. Syrups are concentrated aqueous solution of sugar. Flavored syrups are convenient form of mask the disagreeable taste. Elixir. Elixir are pleasant flavored, clear liquid, oral preparation of potent or nauseous drug. Vehicle may contain high proportion of ethanol or sucrose, or both are together with certain antimicrobial preservative which may lead to stabilize the preparation. Linctus are viscous liquid for oral preparation, usually prescribed for the relief of cough. In that case, we have high proportion of glycerol show the demulcent effect on the membrane of throat. The dose volume 5 ml to produce demulcent action without any dilution. The oral drops are also liquid preparation for oral use and tend to administer in small volume. They may solution, suspension or emulsion. Gargles are aqueous solution used in prevention of treatment of throat infection. The patient should have dilute with the water before use. Mouthwash are as similar to the gargle. They are used for oral hygiene to treat the infection of mouth. In case of dermal dosage form, we have a ointment. The ointments are semi-solid greasy preparation for the application to the skin, rectum or nasal mucosa. The base is usually anhydrous, immiscible with screen or skin secretions. These may be used as an emollient or dissolved medicament to the skin. Cream. Creams are semi-solid emulsion. They are mixture of oil and water, broadly divided into two types: oil in water or water in oil. In oil in water, composed of small droplet of oil dispersed in continuous aqueous phase. In case of water in oil, the small droplet of water dispersed in a continuous oily phase. The main difference between oil in water and water in oil. In oil in water, dispersion will a continuous aqueous phase. In case of water in oil, the dispersion in a continuous oily phase. They are most probably used as a moisturizing to provide a oily barrier which will reduce the loss of dryness. Next point,